Thank you, Academy. Thank you, everyone, for coming for the last day of the conference, Sunday morning. Probably 95% of everybody is left, except for you. So bravo to you. Give yourself a hand. So I'm a sports medicine physician in Boulder, Colorado. I do outpatient musculoskeletal and spine care. And I am now saving women's lives as we speak. And I will tell you my story of how I got here. About 5 years ago, I was running with my dog in Boulder, Colorado. Oh, here we go. And my dog decides to stop and chase a squirrel. So I'm running, and my dog stops in the middle of the trail. I jump to avoid her and sprain my ankle, feel a pop, immediate pain. Being the smart physiatrist, I know that painful pops in the joint are not usually good. So I go to my office and I pull out my ultrasound books and my anatomy books and my ultrasound machine, and I'm trying to figure out what I'm looking at on this screen. And I've been doing ultrasound for 15 years. Before they had courses, they had 2 books out of Eastern Europe, and it's a lot of self-study and then subsequent courses. And I realized that the cognitive load for learning ultrasound is profound. There's so much to learn, and it's hard to make it stick. And I thought, how can you take a complex procedure or skill set like flying a helicopter and break it down into some simple tasks so you can actually gain some confidence to ride the bicycle? So I started doing some research on learning theory, and I came upon this Ebbinghaus forgetful curve, which is the idea that 96% of what you'll learn in this Academy meeting today or this week, you'll forget. And you'll retain maybe 4 to 6%. And then you come back and you learn a little bit more. Every time that you refresh your memory and you restudy, you gain a little bit more knowledge. It sticks a little bit more. And there's something about that spacing and forgetting which is powerful, which makes it stick. You don't use it, you lose it. So there's a famous physicist that said if you do what you always did, you get what you always got. So I thought, well, this is high tech, why not make an app? So I took all of the information from the courses that I took, or some of the key information from the courses I took, anatomy books, and the online videos, etc., and I put them into an Apple iPad. So you could use it like a GPS on your dashboard, so while you're scanning, you can reference it and use it as needed. And it turned out to be a very fast way of learning ultrasound because it's pertinent to where you are in your skill level. But my heart was in international health. I've spent some work overseas before I went to medical school, and I really felt that tennis elbow and golfer's elbow is not a priority in international health. So I decided to change my software a little bit, and trying to find something that's pertinent internationally. And I found that every 2 minutes, a woman dies in pregnancy or childbirth. So during my talk, 5 women will have died around the world. During this whole conference, just this morning, about 45 women will have died. And that struck me as kind of almost obscene. So I took all of the MSK content out of my software, and I teamed up with some expert sonography, OBGYN sonographers, and we made a women's health app. And we used that to teach women, to teach nurses that work in remote parts of the world how to do basic prenatal scanning. Now, I found a Chinese, and I'm not promoting this is not FDA approved, it's not available in this country, but it is usable in Nepal or around the world because it has a European FDA equivalent. But this is a wireless probe that can link up to an iPad. And it makes a Wi-Fi connection, and that in itself is an ultrasound machine. So it's super portable, it's adequate image quality, and it works. We went over there, we weren't sure if it was good enough, but it did work, and we tested it. So we went out and we shook the bushes for iPads. We went to companies, put out a big campaign for donate your old iPad, save some lives. We raised money for buying these probes, which cost about $1,200 a piece, and I assembled a team of expert OBGYN sonographers and a couple of assistants, and including my wife, and we went over to Nepal, totally blind, trying to save the world. We teamed up with an organization called One Heart Worldwide, who were training women or nurses how to become skilled midwives. These nurses work in remote parts of Nepal and are out there by themselves with no support. We taught them how to identify placenta previa, breech, how to measure the head and the femur length, to identify the age, and try to find the 6 key things that will kill the mother during labor. We had a mantra: head, heart, placenta, how much fluid, how many babies, and how big. And every morning we would stand up and we'd do this mantra, and by the end of 5 days, we actually taught them how to identify those 6 things. We also had to teach them iPad, the technology. That was the hardest part. The first trip that we went, we got an A++ for teaching ultrasound. We got a C- for teaching how to use an iPad. And so we went back the second time with some high school and college kids, and they rocked it. They taught them how to use the technology. The nurses over there were fascinated with the iPad, and of course the first thing they did was take selfies. Yeah. But when everything settled down, we did a lot of hands-on training, which is what ultrasound is about, and we taught these women how to scan and identify abnormals. They all graduated with confidence. We measured their confidence scores, and they were about 9 out of 10 in the confidence scale in using all this stuff, and then they returned home. Some of these nurses took 7 to 9 days to get back to their village. And so the whole concept and they work in small little clinics that are set up by the government in these birth centers. Some of the women will do home visits, and they basically identify those pregnant mothers who will probably die if they stay in the village if they deliver their baby. So ultrasound it's almost like a crystal ball. You can see that death is imminent if they stay. So this is a basket that they'll sometimes carry the women to the clinic or out of the mountains on the top of their head and back. So this is an image of one of the clinics that one of the women that we trained, and the women are all lined up, and they got it. We went out, they showed us that they knew how to scan, they identified the women that had to get out of the mountains, and it was a success. And the beautiful thing is we had these iPads that we could track. You can find my iPad, and we can geo-track these. Whoever's connected to the internet at the time, most of our iPads are offline, but we can drill down, and you can see the roads that get to these clinics. You can see it's not easy, and most of the time the roads are washed out from landslides, and they have to walk mostly 5 days and finally catch a bus and then drive for 2. So the organization that we teamed up with, One Heart Worldwide, collects data, and they do it by hand. Every clinic marks how many scans they do, how many referrals they make to the regional hospital per month, actually per day, and then they make quarterly reports. And the average information coming out is that we're saving about 10 to 15 mothers' lives per month. Yeah. There was one mother who came into the clinic that we were visiting. She had delivered her baby at home alone. The men don't get involved with the delivery. The mothers, the other women in the village sometimes don't want to get involved with body fluid. So this poor mother delivered her baby. The placenta didn't deliver, and she walked 3 days with a bleeding trail to the clinic just to get some help. So in Nepal, we're trying to, right now they have 11 districts, kind of like they have 65 districts, which is like our 50 states. They have populated some of the birth centers in 11 of those. Our goal is to get ultrasound through the entire country of Nepal. We've been invited to Africa, several countries in Africa, South America and Central America, bringing the same program, this 1-week intensive training. And we developed this nonprofit organization to do that. And our motto is saving lives with ultrasound in remote areas together. And it takes a collective. Helen Keller said, alone you can do a little, together you can do a lot. This is my take-home message. If you have an idea that seems to make things easier, follow your intuition. Try it. You never know where it's going to lead you. My dog, Maya, whose name, the etymology of Maya, actually means the goddess of fertility. She was also the daughter of Atlas, holding up the world, and is the mother of Hermes, who was the messenger god and also the patron of sports. There is the full circle of a sports medicine physician saving mothers around the world. So now what? So what we're going to do is we're going to start a major campaign for collecting iPads from corporations and private individuals. We can geo-track them, tell them how many lives their iPad has saved. We are raising money for ultrasound probes, and we're working with other organizations that are already doing women's health care around the world. If you have any questions, feel free to contact me through info@miyagi.org. Thank you very much.